What's up, everybody? Welcome back to HealthSparx, featuring the brightest entrepreneurs and innovations in the health and technology arena. I'm Michael Walsh, your host. Another great episode on tap for today. Another international guest coming to us from Alberta, Canada. It's Fab Chiacchia, the co-founder and CEO of Surface Medical. They are a DME company, I guess is a good way to describe them. Up north, doing some great work. They just released a product called CleanPatch. So really excited to welcome him to the show to tell us all about that and share their story. A couple quick things before we get started. As always, please subscribe to the show here on the website. You can go to healthsparx.com/subscribe, or really just anywhere here on the website you can get to it. Really, any posting, anything like that. This is just a way for me to deliver all the content straight to you each week. I release all of my episodes every Tuesday morning. So, of course, I share it all via social media, but this way I can just send it straight to you and you get it. So there's that. A couple other things. I'm going to start running some different Twitter campaigns and things like that using a hashtag HealthSparx. So I'm going to be asking a bunch of questions and things like that. So be sure to follow us. The account is just HealthSparx on Twitter, and there'll be all sorts of questions and things like that. I'm working on some different perks and promotions I'm going to start running through the Twitter account as well, so stay tuned. And last but not least, of course, thank you as always to Satori Tech Solutions. You guys are the best. I love you guys. Thanks so much for all the great work you do. If you ever have a need for a IT firm that does web, mobile, social media, SEO, any of this stuff, reach out to me here on the website. I'll put you in touch with them. They do fantastic work. They would love to meet with you about a startup that you would like to launch, any ideas you might have for any products or anything like that you've found a problem that needs solving. So, SatoriTechSolutions.com. Check these guys out. All right, if nothing else, let's get into today's show. All right, today on HealthSparx, I've got my first Canadian guest on the show. It's Fabrizio Chiacchia. Say that 10 times fast. I'm just chatting with Fab here before the show, and I'm like, where are you from? And he's like, Italy. I'm like, duh, I guess I should have known that. I studied in Rome for a whole semester, and I didn't recognize the name. But Fab coming to us from Canada. He's the co-founder and CEO of Surface Medical. It's a DME company based up in Alberta. Here to chat about a bunch of stuff going on with his company, including a exciting new product called CleanPatch. So Fab, how's it going, my man? Welcome to the show.
Awesome. Thanks so much for having me. It's good to be here.
Yeah, I got to tell you, we were just chatting about it a little bit ago, but I don't know a whole lot about medical devices, especially some of this cool stuff you guys are doing with CleanPatch. So super excited that you could join me today to teach me, enlighten me about all the cool stuff that you guys are doing in this industry. So before we get into Surface Medical and CleanPatch, let's chat a little bit about you. So you came from Italy, or were you born in Canada? Were you born over in Italy?
No, my parents were born over in Italy, but I was born here in Canada.
Okay, so where did you sort of grow up? Where did you go to school? Just give us some background about you.
Yeah, sure. So I was born and raised in Calgary, Alberta, Canada, which is just east of the Rocky Mountains. So spent a lot of time up over in the mountains. Grew up here, went to university here. At a certain point, I went to university out in Ontario to Queens, and then came back here and started working. My first job was really working with, it was actually working in science and engineering. So I built a summer camp during university called Minds in Motion, which was for kids from ages 3 to 15, where we got them involved in all sorts of cool science and engineering projects, and did that during university. And then after university, which was in the sciences, I went on and kind of got a job working for a pharmaceutical company doing research, just basic bench research for a number of years, and worked my way up and did some really cool stuff along the way, and until my wife and I decided to check out and travel the world for a bit, and then we came back here and came across this great little idea and started Surface Medical.
Awesome. Yeah, so I'm curious, how long were you out traveling with your wife?
Oh, so my wife's an accountant. She worked for the big firms, and I was working 100-hour weeks for a few years, and so we basically just called it quits.
You're like, I'm good. We're out of here for a bit.
Yeah. So we took 6 months off, and we traveled. What did we do? We did 10 countries and 100 cities and just took time and just traveled all over the place. So it was fantastic.
Damn, that's incredible. And I'm curious, this whole Minds in Motion thing, any companies that came out of this? I mean, did these kids come up with some ideas that ended up being monetized?
I don't know. At the time, it was just introducing them to the concept of science and engineering, right? So it was a summer camp, so they'd come and they do just projects for the summer, everything from like working with Lego Mindstorms and building robots to learning about how to build rockets and stuff like that. So just fun kind of stuff to get kids interested, and with real focus on women and girls in science and engineering. So it was great. It was a great program.
That's awesome. Yeah, we've had similar type of programs kind of sprout up here in the U.S. I've seen and been invited to some of these to participate, like trying to get kids interested in health, technology, entrepreneurship, and inviting local people, local professionals to come out and sort of lead this effort. So I think it's fantastic. That's great that you're getting kids involved. Okay, so you spend a bunch of time, working your way up the corporate ladder, came up with this cool idea, you said. So I'm curious, what idea was this?
Well, so it wasn't me that actually came up with it. So I built my career basically making pharmaceuticals, drugs, and so there's making pharmaceuticals is a risky, high cost, long development pipeline business. And so I was talking with a bunch of people in the medical community, and I came across this nurse, and actually a chiropractor. So a nurse by the name of Barbara Potter and a chiropractor by the name of Jeff Schachter. And they both basically had the same idea. And what it was both of them have tables and mattresses in their facilities. Barb has mattresses in her in the hospital, and Jeff had mattresses or a table in his clinic, and they were both complaining that these mattresses get damaged on a frequent basis. Once they're damaged, there's a huge indirect cost, and in the hospital, less so in a professional health office, there's a risk of a hospital-acquired infection. And so we got to talking about it, and I said, well, there's got to be a simple solution out there for this, and they said, there isn't. And so,
Nope.
so I went and I did a bunch of research, right? Like I put on my kind of R&D hat, and I went into the literature and did a bunch of reading, and I went online and I went through the patent database and all sorts of stuff. And I couldn't really find a good, simple, effective solution. So, having come from this complex, high cost area of pharmaceuticals, I looked at this really simple, elegant solution of building with what we call now CleanPatch to solve a really big problem. And so that appealed to me. And so we started the company late 2010 and called it Surface Medical, and I've been kind of plugging away on it since.
Awesome. All right, so the three of you then are the founders of this company. You, Barbara, and you mentioned your chiropractor. I forget his name.
Jeff. And there was another gentleman, Tom Collins, who's kind of the senior gray-haired business guy who he's been around and done many things. And so it was kind of Jeff and Barb had the idea. Tom had the business savvy to recognize that there was an opportunity here, and I was the guy who had the experience in actually building medical products. And so Barb and Jeff gave me the idea. Tom gave me the stewardship and the guidance, and then I put together the company and started executing.
Awesome. Now, I want to get into a bunch of the details here about CleanPatch and kind of what it's doing and what the impact of this is. But before we do, I want to spend just a little bit of time, too. You being my first guest from Canada, I want to spend just a minute because HealthSparx is all about, again, just stories from all over the world. I've had guests from all over the U.S. I had my first guest from Australia on. I'm curious, what is the landscape there in terms of healthcare up in Alberta? I mean, what do you guys see that may be up there that's maybe a little bit different than here in the U.S., or what are the big issues you guys are talking about up there? What's kind of going on? Give us the 60-second pitch about healthcare in Alberta.
Well, so Canada's a different system than the U.S. We're publicly funded healthcare, and so while we have great funding from our federal and provincial governments, it's a lot of the same problems that you experience in the U.S., right? You've got an elderly population that's getting older. You've got pressures on the budget. You've got chronic diseases that are becoming more prevalent, and so as a result, you just have this huge need to find solutions to a lot of these problems. And And you know, they typically come in the form of finding ways to either reduce budget through process or, you know, some kind of software implementation, all the way through to, you know, changing the way that we pay for drugs. So
Right.
you know, in my opinion, it's this fantastic time in healthcare where you have this influx of problems, and you know, for the few of us that are opportunistic, we can go in there and make some significant changes with, you know, simple, elegant problem solutions.
Absolutely. You almost named my tagline right there for the show, man. Like that's what this is all about. Like getting people together and making things happen. Because yeah, I agree. I have a lot of these problems. They've been baking under the surface for years and years and years, and finally they're manifesting themselves. And it's never been a more exciting time in healthcare. Like every week, new startups are popping up to solve some of these problems. So it's incredible.
Yeah.
Okay, so getting back to Surface Medical, how when the three or four of you guys got together to get all this stuff rolling, how was the company originally funded? Did you guys have partnership opportunities that you guys took advantage of, or was this just bootstrapped?
It was a combination between bootstrapping and some, you know, evangelists. Basically, we found some angel investors and we told them the story of what our vision was, and they said, okay, well, it's interesting enough, you know, here's a little bit of money to go get off the ground, come back in 6 months and let's see where you are. And so that's what we did. So we did that, and from there we hit certain milestones, and then they actually gave us some more money. We've
Excellent.
had unbelievable angels where they've invested several times. And then as we move the idea along to actually becoming a real product, then we were able to tap into some of the government funding. So one of the things in Canada is you have just fantastic sources of funding, both at the federal level and provincial level, to really take advantage of for R&D type projects. And so we did. We were able to raise a good chunk of capital that way.
All right, so you briefly mentioned, let's get into CleanPatch
Sure.
a little bit. You briefly mentioned what this was, but I want to kind of start at the beginning.
Okay.
You even briefly mentioned what the problem was, but let's go through it. So Barbara kind of approached you with this issue of, we've got stuff in our hospital systems, in our doctors' offices that is just, it's breaking down. It's enabling HAIs, and you can define what that is here in a second, to spread and to become, you know, an issue. So let's really dig into what this problem is and what the impact is on really everybody.
Yeah. So it's actually really intuitive. So what it is hospital mattresses are, mattresses, stretchers, any kind of furniture in a hospital, they're a high-touch, high-risk surface. So basically you have patients being in contact with these surfaces all the time. What happens is these surfaces, because there's so much use, they end up getting damaged. So cuts, tears, nicks, punctures, etc. And really, the only way to deal with those nicks, cuts, tears, damage is to really replace it. Unfortunately, the replacement cost is so high. And so what ends up happening is a lot of these mattresses will stay in circulation, and these pathogens from sick patients will either fester inside the cut, the damage, or they'll stay on the surface. And even with routine cleaning, you still find that a lot of these pathogens remain. And so when the next patient comes along, they end up getting sick. And so you end up putting a patient at risk for a hospital-acquired infection, which is hospital-acquired infections are infections that a patient gets that they didn't have when they entered the hospital. They get a new infection on their way out, hence hospital-acquired infections. And so,
Right.
And so the problem that we're trying to solve is what to do with these damaged mattresses, right? And so, you know, the company Surface Medical, we named it that because the idea is to keep surfaces clean and patients safe.
Mm-hmm. Awesome. Okay, so we're talking specifically CleanPatch is we're focusing on the mattresses or like couches or some of this other stuff. You know, in terms of all the research that you would have done when you were sort of prepping this product, what did you find with HAIs? Like, I mean, how big of an issue is this?
Well, so the stats, the stats out there are 1 in 9 patients that enter a hospital leave a hospital with a hospital-acquired infection. So it's
1 in 9, did
yeah,
you
it's
say?
1 in 9. So it's a
Wow.
big number. When you actually talk to physicians, it's probably closer to 1 in 5. And the issue is that every single hospital-acquired infection costs a hospital somewhere between $25,000 plus or minus. And because in the U.S. Hospital-acquired infections are the cost of it is actually the responsibility of the hospital. Insurers don't cover that, so that hits the bottom line of hospitals. So every time 1 in 9 patients that roll through is going to end up costing the hospital 25 grand, and they're responsible for that cost. So you can just see the how this issue erodes budgets, and that's why it's such a big problem. Where a lot of the focus has been in terms of hospital-acquired infections is hand hygiene, right? Everybody knows that you need to wash your hands, but what's becoming more prevalent is this concept around environmental hygiene, which is the environment around the patient is dirty, right? Which is really intuitive.
I mean, for those of you who have stepped into a hospital for the last 5-10 years, you totally know what we're talking about.
Right. And so you've got like these bacteria and pathogens growing everywhere, and people are trying to tackle this problem with new cleaners and
Windex.
Clorox is now making a big push to get their bleach basically into the hospitals as a cleaner, right? And you have lots of people trying to use silver, and you have lots of other really just amazing technologies out there trying to tackle this stuff. And so there's a big push to keep the environment clean, and hospitals, for simply cost purposes as well as keeping patients safe, are adopting a lot of these new technologies to deal with it.
All right, so I think we've done a good job here laying the problem out. So how does this product work? I mean, is it like a spray? Is it like what does this do? Like if you walk into a hospital system and you're meeting with them to kind of go over all this with them, what is it that you're handing them?
So CleanPatch is a patch. So
literally it is.
Yeah,
like it's just
we looked at the spectrum, right? We said, okay, can you use a spray, something like that? But sprays are messy, they take time, they can result in gooey messes. Suturing a patch or a pad back onto the mattress doesn't really work. You can use an entirely new cover, but that doesn't really work either because the covers themselves get damaged. So we just thought of developing, again, like a really just simple, elegant solution. So we basically developed a bed bandage, right? So as you go into a hospital, as a nurse or as some of the facilities and maintenance people or housekeeping, identify a little nick, cut, tear, or damage in the mattress, they can basically pull out this patch and apply it, right? And it takes seconds to apply. It's low downtime, so you minimize a lot of the indirect costs. It's relatively inexpensive to replacing the hospital mattress, and that means mattress stay in circulation. You're reducing the risk of hospital-acquired infections, and you're saving hospitals money. It's like direct hard dollars.
I'm curious. So just along those same lines, how much does a hospital mattress cost? On average,
somewhere around $300 to $800 a mattress, and the technology around mattresses is really expanded over the last few years, and so you can get all the way up to like $10,000 a piece. But your average run-of-the-mill stretcher or just bedtime mattress, it's around $500.
So how much is CleanPatch then for per unit, or how is it being sold?
We're selling 20 in a box. Each box is $300, so $15 relative to 30 is kind of the hard economics on the patch.
Yeah, it seems kind of no-brainish, right?
Well, and when you tack in your indirect costs, right? Like a nurse recognizes a problem, then she's got to call somebody. Somebody has to come up, grab the mattress, take it out of circulation. So now they're down a mattress, and then it has to get transported down to somewhere for somebody to...
all the time and effort.
Yeah, like it's and that's what I mean, right? Like I firmly believe, having now spent 2 to 3 years on CleanPatch and this problem, I believe that there are hundreds, if not thousands of problems in the hospital like this that people can go in and basically identify and develop these elegant little solutions that have really big benefits. And I think that's where healthcare needs to go, right? Nobody can really afford to pay for all the big stuff. Let's help them find small things.
Absolutely. So also curious, as you guys have sort of done your initial testing and brought the product to life, Have you been able to capture any data or statistics kind of showing within maybe a hospital setting that you've put these in, where HAIs have come down?
Yeah, so I would love to. So what I can tell you is this. If you go into the literature since about 1979, there's been about 50 papers that have been published that really demonstrate a few things. One is hospital mattresses harbor pathogens. Damaged mattresses also harbor pathogens. Those pathogens can result in the transmission of a disease, and they can also result in the outbreak of a disease. And when you implement protocols or new mattresses to basically restore the mattress to an intact and cleanable state, you can actually minimize those outbreaks. So that's what the literature shows. What we've done is we've gone in and kind of validated some of that. And we've actually done a clinical study to illustrate that our patch, when applied to a mattress surface, is equivalent to the mattress surface. So there's no more and no less bugs on it. We haven't been able to go as far as making claims around hospital-acquired infections because it's such a ubiquitous problem. There's bugs everywhere. The studies huge, right? So, but there's lots of really good data out there that point to this problem and how you can implement, again, simple problems or simple solutions to solve it.
So how are you guys marketing this product? I mean, is this something that you're starting right there in Alberta and kind of taking it from there, or were you kind of taking a more worldly approach?
We're gonna stay close to home to begin with. So our plan is to work directly with hospitals in the next 3 to 6 months, so that we can stay close to our customer, learn from our customer, learn how the product is adopted, where can it be adopted, who's going to use it, and all of those really useful things. And then we're going to develop a whole bunch more products around that. So we're going to stay close to home. We're going to learn, and then late this year, early next year, we're going to start moving to the US and the UK. And that's kind of our path forward.
Excellent. And startup founders out there listening, or just really anybody who has an interest in this stuff, I mean, this is the proven and patented lean startup model in action right here, people. Like, putting together that MVP and testing it locally and capturing as much feedback as you can, making adjustments on the fly and going from there. And the strategy sounds incredible, and just the product sounds even more incredible. So really, really excited about all this. What's next for you guys, really? Okay, so you're out there, you're trying to sell this product. I mean, Surface Medical, I'm guessing, has other ideas, other things that they're going to be working on. So what's next? Are we just focusing on CleanPatch for a while, or where are we going?
So here's what I can't give you the specifics, but here's what I can tell you.
All right. I figured I'd ask.
So we've got a product development path around CleanPatch. There's, we've kind of opened up Pandora's box on this concept of how do you deal with a damaged mattress. And so we've got a really clear product development path and vision of what we want to do with CleanPatch. But the concept behind Surface Medical goes back to some of the stuff that I talked about earlier. Our goal is to really stay close to frontline practitioners and talk to those frontline practitioners about the problems that they're encountering on a regular basis. And we're actually developing a mechanism to basically take all those problems and funnel them down into, pervasive, common problems that you can solve with simple Class 1 medical devices. And that's sure. Kind of the vision in the future for Surface Medical is to work on those things.
You know what? I have a feeling that once you go through it here this first time, the second, third, fourth, and fifth times are going to seem like a walk in the park.
Yeah.
You're going to be like, oh, we've already done this before. This is no problem.
I've got a few more gray hairs and a little less hair after going through this one.
I totally know what you mean, dude. Totally know. All right, so all good stuff from Surface Medical and CleanPatch, but I always like to sort of wrap up with some good stuff from you. Just you being an entrepreneur, you and your team here, you've put together this company, this product. So curious as to what lessons you've learned, important advice that you might have to share for entrepreneurs or startup companies out there, or again, really just anybody interested in health and technology right now and all the opportunity, what they could take away, what they could be thinking about that you could help them out with.
Well, I think I already alluded to that now is as good a time as any to be out there and developing products for healthcare. From experience in building companies, it's been make sure you have a vision, stick to it, hire really good people, and make sure that the people that you hire you can trust. Right, these are people that when you send them out onto the battlefield, that they'll execute on the plan that you've given them. And
Sure.
Probably most important is investors, advisors, and the people that you surround yourself, make sure that they believe in you, because you're going to have a lot of highs and a lot of lows and a lot of bumps along the way, and you want those people to be there. So be honest and transparent, and I don't know. That's about it. That's just been kind of my experience.
I'm kind of curious, just and not to
Sure.
put you on the spot, you don't have to get into too nitty-gritty details, but would you be willing to share maybe one of the bigger mistakes you guys have made along the way? I mean, everybody makes mistakes. I make mistakes every day. I encourage everybody I meet that wants to launch a startup to make mistakes every day, because that's how you learn. Any of note come to mind that you guys have made over the last couple of years, bringing this all to life?
Probably one of the biggest mistakes that we've made, and probably one of the more costly mistakes we've made is around people. If there's people that aren't working, then you're a lean small company. You don't really have time to help them along, right? You got to kind of cut them as quickly as possible and move on. That's probably
Right.
one of the bigger mistakes, but there's lots. God, there's a long list.
I know. Well, and that's why I said it's tough to narrow, right? And I
Yeah,
don't mean
no,
to
it's
put you on
fine.
the spot, but it's always fun to try and come up with a quick lesson that you run into that might be able to save somebody else, the heartache that you may have gone through with it. So, yeah. All right. Well, this has been awesome, man. Really, really excited about your product and everything you guys are doing, and can't wait to maybe bring you back on the show at some point when you guys get ready to bring CleanPatch to the United States. We can maybe bring you back and talk about all the good stuff you're prepping to do here in the U.S. and some of the partners you're working with, and we can help promote it as much as we
That sounds
can.
great.
So,
Thanks.
yeah, really appreciate you taking the time, Fab, to come out and share everything about your product.
Thanks for taking the time.
All right, and that is it for Fab and I. Great stuff today. This was really fun. I'll be the first to tell you that medical devices are one of those things that I just don't know much about. I know I preach through HealthSparx and through Health 2.0 about all the innovative technologies going on in health these days, but I'll be the first to tell you that medical devices are a huge gap in my knowledge base. I just don't know a whole lot about it. So very appreciative of Fab for coming on the show and explaining all of this stuff to us, reminding me what an HAI is and how important it is that we cut these down. I couldn't believe that he said 1 in 9 patients are coming through the door and walking out with some other infection that they didn't have when they walked in. So pretty serious issue that Surface Medical is looking to solve. Be sure to connect with these guys if you're interested in learning more, especially as they look to launch their product in the U.S. in the coming 6 to 12 months. A few things before we sign off. As always, make sure you subscribe. I remind you guys of this all the time. It's just a way for me to deliver the content, but it's a great way for me to get in touch with you about other cool stuff going on and share other great insights, advice, tips, all these things from my guests that come on the show that may not have come through the episode, but we do spend a good 10-15 minutes talking before and after the show. So would love to share that stuff with you as well. So be sure to subscribe here on the website, healthsparx.com/subscribe. I'll send all that stuff to you each Tuesday morning as it comes live. We're also available on iTunes and Stitcher Radio, so you can check HealthSparx out there as well. So until next week, I am your host, Michael Walsh. Looking forward to it. Talk to you guys soon.